sharp mid-back pain, Dr. Madeline here at Forward Spine Center, and maybe it was you slept wrong or you spend all day sitting, and at the end of the day you start having that sharp irritation in the middle of your back, maybe between your spine and your shoulder blade. Today I'm going to demonstrate a treatment here at Forward Spine Center, and it incorporates cupping along with an adjustment and acupuncture. This is a great combination for that irritation in that mid-back, especially when we're dealing with tightness of the muscle, along with some pulling and possibly irritation in the ribs or those intercostal muscles. This is a great combination. A lot of times I'll even top it off with some taping afterwards to really help stabilize it, along with a good exercise routine, stretches, exercises to really help stabilize that area. Stay tuned, and if you have any questions, feel free to reach out. Dr. Madeline here again at Forward Spine Center. Today I'm going to demonstrate a treatment for a patient who presented with acute mid-back pain. So I'm going to start off by doing some cupping. I'm going to adjust the patient, and then we're going to do some acupuncture. So I start off by applying some emollient onto the area. This provides a suction for the cupping. Cupping is a little bit different than soft tissue work because it provides a suction. So it really gets deep into the tissue. And I think it just provides a different form of soft tissue work that a lot of patients I've seen respond really well to. It also increases blood flow into the area before I do acupuncture. So I think it also intensifies the acupuncture treatment. So I target trigger spots, and I warn the patient it can cause bruising or purpling or redness in the area. How does that feel? It feels okay? Okay. Sometimes I'll just suction the area, or sometimes I'll even move the suction cups around to help really deepen the treatment. There. This one I am going to move around slightly. How does that feel? A lot of times I do like to move the cups in a direction where maybe a patient is having a hard time activating. So a lot of times patients will overactivate the upper traps. So they're always asking us to massage the upper back, the upper traps. But really what's happening is they're firing in the upper back, and then they're having a hard time activating maybe the lats or the lower rhomboids. So I'll incorporate some cupping to also turn on and get the patient to feel a little bit more sensation in the lower thoracic area where maybe they should be firing a little bit more. How does that feel? Good. Good. So this patient unfortunately woke up with some mid-back discomfort. She was busy cleaning over the weekend. Maybe she was doing a lot of repetitive bending forward, lifting, kind of straining the body in different ways. This suction cupping also helps to break up adhesions or improper scar tissue that we don't want in there that's maybe causing a muscle to not properly contract. So it just helps to intensify the treatment. And it feels pretty good. Does it feel good?
That's great.
Yeah, a lot of patients love it. But you see how red it's getting? Yeah. And that's not uncommon to bruise a little bit. Yeah, like right up there. Right. So after we do some cupping and we relax the area. Then I adjust. Cupping also helps, so then I can feel the tissue a little bit more, figure out where specifically I want to adjust. Deep breath in, and then all the way up. Good. Nice. With the cupping and the acupuncture and the adjustments, it's a lot of soft tissue work, a lot of muscle work, and I always recommend stretching or some light movement afterwards. Please don't go and sit at your computer or stay sedentary. Move the body. Got one more deep breath in. Good, and then all the way up. Yeah. There. Okay. I'm going to get ready to set the patient up for some acupuncture. Now that we've cupped the area and adjusted, I'm going to top it off with some acupuncture. Oftentimes what happens is when someone has that acute pain in the mid-back, it could also mean some overstretching of the area. So what we want to do is we want to retrain the tissue to tighten, to stabilize. Acupuncture really helps to stabilize that area. A lot of people will say, I have a rib that always goes out. Well, what's actually happening is that rib is being overstretched over and over again, and you're irritating those little muscles, that little tissue that lines in between the ribs. And acupuncture really helps to stabilize that area, to turn on those little tendons, those little muscle fibers, to stabilize it. So that's what we're going to do. And this patient is really presenting with more left-sided upper back pain. So I'm going to target that area. First, we sanitize the area, and then I warn the patient it's going to feel like a little mosquito bite when it goes in, little poke. How'd that feel? That's great. Okay. Acupuncture has a lot of benefits. It increases blood flow into the area. It helps. It helps with chronic pain as well. A lot of times when patients have chronic pain, they always have a pain signal. There's a nerve that's constantly being fired, that's irritated, and what acupuncture helps is to shut that pain gate, to turn off that pain signal. By changing the nociceptors of that nerve. You think when we needle the area, the body grabs onto the needle. So it also helps to retrain the body to turn off and then turn back on, to turn off and turn back on. You're having more pain up here? Yeah. Yeah. I'm going to do the right side as well. All right, I'm just going to continue doing some acupuncture treatment on this patient. I do recommend that the patient moves around after the treatment, be graceful to the body, gentle to the body. Some people feel very relaxed after acupuncture, while some people feel more energized. Just to be kind to your body and meet it wherever it's at. Dr. Madeline, thank you for allowing me to be part of your health journey.